I'm a psychologist, and something that has been quite, frequent in recent terms, in recent language in our profession, especially in Australia, is culturally responsive practice. Um, and I'm Indian, and I think and wonder about what that really means, in the sense of, apart from having tick boxes, what does culturally informed practice really mean? There's no scale to measure it. There is no way to understand whether you're actually being culturally informed or not, apart from qualitative data. And this is something that I have been thinking about and stewing over for a couple of months, in the sense of understanding for myself what culturally responsive practice looks like. And if you're a psychologist out there as well who can relate to this, feel free to give me a follow, because these are the kind of topics that I'll be talking about more, while I learn myself and share my reflections with you. So if you think about culturally responsive practice, it's essentially, the first and the foremost thing is about being curious. Curious about the other person's culture, curious about their own perceptions of their culture, curious about their own perceptions of, for example, even therapy. And what does that really mean? Culture has essentially these days got a very much this approach to it, which is culture is seen to be only for those people or those clients that have a different skin color. And I actually do not agree to that. I think culture, everybody is part of a culture. It has nothing to do with your skin color, right? However, when people say there's culturally informed practices, yes, there are different cultures that have different practices as compared to your traditional Eurocentric mental health frameworks. So I think just labeling the other side as just being culture is not fair to either parties or either approaches or frameworks, because that's not really helping anybody. If I have a Caucasian client walk in as a clinician of color, I need to present with equal amount of curiosity as I would expect a clinician from a different, from a Caucasian background, having a client of maybe of color, right? So I guess what I'm trying to say is through this, that culture and being aware of culturally informed practice is actually having a sense of curiosity, right? And that in itself is something that we're taught first in our clinical trainings, and which is that having or being aware of your own biases, right? Because culture can also look like having biases around owning a home, having biases around having kids, having biases around looking in a certain way, having biases around, the kind of education you have or the economic foundations that you've come from. So these are all biases that we carry. And as a psychologist, being aware of those is very important when a client comes in, regardless of their cultural background. But if you're trained in a certain Eurocentric framework, then it is important to question the other cultures. So I work with a lot of Caucasian clients, and I have to still come with these approaches and curiosity with every client that walks in through the door, because they all present with their own contextual cultures, which may look entirely different to the person I've seen before. And this is something that I find very, very interesting in this culturally informed approaches that we see these days, which is everyone's talking about being culturally informed, but there's little to no guidance around what exactly does that mean and how we can execute that. So hopefully this is a bit helpful for those who are in that curious space and wanting to learn what it looks like. Follow me along, because this is what I'm curious about myself, in order to speak about these things and challenge some things that are probably not working for either you or me.